Okay, so there seems to be an emergency situation happening right now. But first, I must do a scene size-up. Okay? So the scene seems to be safe with the parent of the child being present, and there are no other bystanders available to help. I am alone, so I need to perform the first responder's responsibilities. Before that, I need to make sure that I am safe, so I perform the substance isolation precautions such as washing my hands with alcohol before donning my gloves and my mask. After that, I can then check up on the patient. Sir, are you choking? There's only the nod from the patient while doing the universal sign of choking and having a pale face with a shocked facial expression. So there's the need for me to give care. Sir, good afternoon. My name is John Katipunan. I am a trained lay responder and I see that your son is choking. I know how to help him. May I help him? The father agrees, and then I can now give care towards his child. In doing back blows, my arm should be across the chest while the body is being tilted forward by the waist. After that, the body should be parallel to the ground with my hand in the middle of the shoulder blade where the back blows would commence. Make sure to not hit that hard. So since there is no coughing, I shall then perform abdominal thrusts. I shall first find the belly button with 2 fingers, and the other hand should form a fist with the thumb inside. I shall then place the fisted hand above the belly button, which is here, and cover it with the other hand. I shall then proceed to tell the patient to lift up their elbows. While doing so, I then proceed to performing the upward and inward movement of the abdominal thrusts. Continue doing these movements until the person coughs or becomes unconscious. In the cases where the patient becomes unconscious, lay them gently on the ground while preparing the parent to call the emergency rescue units. So, ma'am, can you please call 161 or 255-7287 and please tell them that there is an emergency in Jollibee, Banawa and it's in need of medical assistance. Tell them that this is your personal phone number and that they can contact you in case they are on their way or are having a hard time coming here. Tell them that the patient is a child who was choking and is now unconscious while being given care by the responder, and now the responder is planning to give CPR to the patient. So while waiting for the responders to arrive, I shall now proceed to performing chest compressions. Adjust the head first if it's on the way, then find the center and at the lower third of the sternum, place your one hand over the other with fingers interlaced and perform 30 chest compressions under 1/3 depth of the chest and in the rate of 100 to 120 chest compressions per minute. 1 and a 2 and a 3 and a 4 and a 5 and a 6 and a 7 and a 8 and a 10 and 11 and a 12 and a 13 and a 14 and a 15, 16, 17, 19, 20. 1, 2, 3, 4, 5, 6, 7, and 9, 30. I shall then check the airway if any obstacles are visible. I will do this by doing a slight tilt. I will do this by doing a slight head tilt chin lift movement. There is still no obstacle, so then I will proceed to performing 2 rescue breaths. I will repeat doing the 30 chest compressions and then check the airway again. Upon checking, an object is already visible, so I sweep it out and perform the 2 rescue breaths again. Since there is still no rising or falling of the chest, I shall do another set of full CPR, which is 30 sets of chest compression with 2 sets of recovery breaths. I will continue doing so until the EMS arrives, an AED is available, or the patient becomes conscious. Why is a blind sweeping not advisable? Because it can further worsen the condition of the patient by further pushing in the obstacle towards the airway. So, if the patient becomes conscious, I shall then place him on a recovery position. Continue to hold this position until help arrives.